we're now going to talk more about this antimicrobial resistance, which is not just a problem in the global south, but for instance, in Norway, we also get imported cases here.
Yeah, that's right. And at Oslo University Hospital, we have been receiving victims of the war in Ukraine. And we have been extensively challenged in treating these patients due to multidrug resistance. And I thought this was an important topic, so I asked my colleague, Associate Professor Kristian Tonby, to tell us more about this. Please, Kristian.
Welcome.
Well, thank you very much for this opportunity to talk about a very important topic about the multidrug-resistant bacterial infections in patients evacuated from the Ukrainian war. And this presentation, it has been then made also with my good colleagues at Oslo University Hospital, Dr. Erik Formanek at the Orthopedic Department, and also Dr. Else Quist Paulsen at the Department of Microbiology. So, this is not just a situation that we have in Ukraine. We know that conflict areas, they fuel antimicrobial resistance. Antimicrobial resistance, AMR, is a silent killer, as also Bjørn Blomberg just recently showed in his presentation. We know in conflict areas, we have now experience from the Ukraine war, from Iraq, from Afghanistan, Syria, Yemen, Libya, and we now have data from these areas that AMR is developing fast in areas with conflict. And why does this spread? And of course, many of these topics here are quite obvious for you because of when you have large-scale displacements of people, when you have compromised health care infrastructure like bombing of the laboratories, you have poor hygiene and sanitation, as a picture here from the trenches in the Ukraine war. You have unstable access to antibiotics, low vaccination coverage, and also then lack of antibiotic stewardship. All these factors, they're really important to get in control of, to tackle the crisis with the antimicrobial resistance. So just to have some definitions about antimicrobial resistance, how resistant are these bugs? Bjørn Blomberg, he just recently mentioned some of them with this ESBL, extended spectrum beta-lactamases. We have the term multidrug resistance, MDR. When we talk about that are bacteria that are resistant to at least one agent in more than 3 antimicrobial categories. That's MDR. But then we have extensively drug resistance, XDR. Then it's resistant to at least one agent in all except for 2 antimicrobial categories. That means that you have 1 or 2 effective antibiotic classes that you may use. So that's extensively drug resistant. And then this really scary thing here is the pan-drug resistant. Then you have resistant to all the agents that you have available. You have no antibiotics to give to the patients. So what do we know about the AMR situation in Europe, in Ukraine, in Norway, just to give you a little bit perspective? And then we have good surveillance data from the ECDC, the European surveillance in Europe. We will not go into details of these epidemiological maps, but these maps show that we have huge resistant problems also in Europe. As you can see here, it's the color here is that the more red, the blood red color, and the brownish color, you have high levels of multidrug-resistant bacteria. Here it's exemplified with the E. coli and also the bacteria called Klebsiella and Acinetobacter. And if you have a brown color there, you have over 75% of the isolates, they are then resistant. So this is a huge problem. And also, it was a recent report in Lancet. Globally, we have 1.3 million deaths every year due to AMR. So this is a huge global health problem. So, about the situation in Ukraine, what do we know? As you saw at the previous slide here, at the epidemiologic maps, Ukraine is not on the surveillance map here. So we have scarce data from the Ukraine. But since 2014, where the war activities began, also in the eastern part of Ukraine, it has become more data from hospitals in Ukraine. And this was a paper a couple of years ago that then focused on that it was more resistant bacteria detected at military hospitals compared to the civilian hospitals in Ukraine. So it was signs of that it was increasing multidrug resistant bacteria there. And then we have more recent from the war now in Ukraine. This is from a German article where they have also received patients from Ukraine and treated patients there, and then they have the screening of the patients to detect if they are carriers of drug-resistant bacteria. And then in this paper here from Germany, they found that they had quite extensive, huge problems with multi-drug resistant bacterial mechanisms. This NDM and OXA48, this is quite detailed, but it's genotypic resistant patterns that the bacteria has, which is important to detect. And then we have from this summer, we have in July, it was a publication from the Lancet Infectious Diseases, from a Swedish research group who, together with the Ukrainian doctors and researchers, they sampled screening samples from hospitals in Ukraine, but due to the compromised health facilities in Ukraine, they sent the samples for the analysis to Sweden. So what they found is very, very worrying. They found that here, in this case, 154 of the isolates that they received, 58% of them, they were resistant to meropenem. And as Björn Blomberg said, meropenem, we regard it as the atomic bomb in the treatment of our infections because it's a very, very broad spectrum antibiotic. We have seen it as a last resource antibiotic. So, and here it's huge numbers of resistance. But even more worrying is that 6% of the isolates that are received, they were resistant to all antibiotics. They were totally drug-resistant, pan-resistant bacteria. So if you haven't been terrified before, you should be now, because this is alarming, because we need to be aware of this huge global health problem, which has been there for several years, but now we have even more focus on it. So at Oslo University Hospital and also at other European hospitals, via the system of the Medevac system, patients have been evacuated from Ukrainian hospitals to other European hospitals. This is a patient that we received during 2022, a patient that had suffered from a mind blast injury in Ukraine. It was performed several surgical procedures in Ukrainian hospitals. And also the patient had infections, and then also broad-spectrum antibiotics were given. But due to lack of improvement and need for higher care level of treatment, then the patient was evacuated to us at Oslo University Hospital. And here you see the picture from his the thigh, the femur, which you can see it's the bone is completely fractured, and it's a very severe kind of fracture. And after admission to the Oslo University Hospital, the patient underwent 17 surgical procedures. That's a lot to get in control of this this disease. And also, it was a severe infection. So the treatment here, just to give you an example of the complexity, was then a procedure with a medullary nail in the femur, and also bone graft was taken to the patient. And also in the end, then the plastic surgeons, they perform partial skin transplantation. This is a very advanced, complex treatment to actually then save these patients. And also during the hospital stay, this patient also had signs of blood poisoning, sepsis. So, as you can understand, this is complex, and we have received several patients, and we see brutal and complex injuries. What is important to also remember is that the life-saving treatment, they have received that in Ukraine. I'm quite amazed about the level of treatment they have received actually in Ukrainian hospitals and the complexity that they have received in their procedures there. But of course, it has been very difficult conditions that the patients has been treated under, and they then have also complications, for example, with the infections because bacteria, they love war wounds. This is a quote I also have taken from Doctors Without Borders, who has also campaigned on these antibiotics in conflict areas. So what we have seen here is that these microbes, these bugs that we detect, bacterial infections, we see that they have difficult to treat resistant patterns, extensively drug resistance. And I won't go into the details, but just to show you a little bit of some examples here. We have these bugs called Enterobacter, Acinetobacter, Klebsiella, and you have this extended spectrum beta-lactamases, ESBL, resistance mechanisms. And then you have this CARBA mechanism and NDM. These are broad spectrum resistance mechanisms. We have very few antibiotics to treat with here. And just as an example, we have this antibiogram where you see on the right here. The different rows is different antibiotics. Where it is an R, the bugs are resistant. We can't use the antibiotics. Where it is an S, it is susceptible. We might use probably the antibiotic has effect. So as you can see here, it's a lot of R's. It's extensively drug resistant. We have very, very few treatment options. And then we know, okay, we have an S on some of these antibiograms. But then, do we have the antibiotics to treat with? And last summer, during 2022, we did not have access to this in Norway. Even in Norway, we have high resources, one of the richest countries in the world. We did not have access to the antibiotics. So what several persons on a pharmacy, they really worked hard to get this treatment. And in this case, it was something called cefidricola, very, very broad spectrum. It's a new antibiotic class, which is a broad spectrum antibiotic, which we then received. So that's own presentation to talk about access to antibiotics. But then also what was important for us was also to tell the authorities that Norway, we have a poor antibiotic preparedness in these kind of situations. We need to receive these patients that need medical help, but if we do so, we also are obliged to actually to have the tools to treat these patients. And then several also of people in this room now, we have been working together to actually also then say, okay, which of these very broad spectrum antibiotics, Björn Blomberg, he mentioned meropenem as well, the atomic bomb. That's actually a much more than narrow spectrum antibiotics than these several of these antibiotics. These are even more broader in their functioning. So this is important to then identify we need these drugs here. So during summer 2022, we realized that, of course, in Norway, we have little experience with complicated war injuries. We had little experience with AMR patterns that was previously never detected in Norway and also previously never detected in other European hospitals. And also, we then needed to use antibiotics and treatment strategies that we have little documentation. There, we have no randomized clinical trials to guide us. Okay, this is the best treatment option for that patient group. These are complicated chronic infections in the bone and joints. And we have no good clinical research to guide us there. And there are also then limited or no access to broad spectrum antibiotics against these extensively drug-resistant bacteria. And also, which we will not talk about now, some of the patients, they also had co-infections with multidrug-resistant tuberculosis and hepatitis, and of course, mental trauma is also very important here. So what we needed at Oslo University Hospital was that it was established a specialized unit for treatment of war injuries from Ukraine. And the reason for that is that to actually be able to treat these patients, we need to have a multidisciplinary team to improve the quality and follow-up of these patients. And as you can see, it's a lot of different specialties. We work together to actually succeed by treating these patients. And as you all are thinking, this is resource demanding. We can do it in Norway, but it is not possible to have this multidisciplinary approach and this resource demanding in areas with conflict zones or war zones. That's difficult. It's difficult even in European hospitals without war. Our experiences so far is that we have only received 36 patients through this evacuation system. It's a rather young population, average age 37 years. 83% of them have suffered from blast injuries. And then most of them, they have been admitted to Ukrainian hospitals for quite a long time. 150 days after the injury, they come and are evacuated. For these chronic infections, in the bone infections, we had 28 episodes, and most of them were then fracture-related, which is complex infections. And we also then found multidrug resistant or extensively drug resistant bacteria in 82% of the patients. And mainly it has been Klebsiella and Acinetobacter baumannii bacteria, which is gram-negative bacteria. And there you also can see the duration of the antibiotics. That's an average treatment of 78 days. That's long treatment because also it's a complex chronic infections that need a lot of surgical procedures, but they also need long treatment duration for the antibiotics. And the problem here is that the 1 or 2 antibiotics that are possible to give, they are only, we have only intravenously availability for them. We don't have the oral drugs. So for some patients we can give, or for some of the bacteria and the patients we can give oral tablets, which are what we prefer, but in some cases we need to treat maybe 2 months, possibly up to 3 months with intravenously antibiotics, also with a lot of side effects. So this is difficult. So it's a lot of complex and difficulties with this issue. And during March, April this year, I attended a Ukraine session at the European Congress in Microbiology and Infectious Diseases. And it was from the chair to one of the Ukrainian doctors that had a presentation there. The chair asked the Ukrainian doctor, so please tell us, what can we do to help you to better control the spread of and treatment of infections in Ukraine? And then the Ukrainian doctor had to stop a little bit and think, and also the interpreter had to ensure that the question was understood. And then the answer was quite like this: help us? Yes, help us to stop the war. So that's just to give the perspective of this problem. Of course, we see AMR as a huge problem, but of course in Ukraine, the huge problem is the war. So that's need to be stopped. So this is then giving you a presentation. It was my last slide, just to give you a presentation about the problems that we actually see in war zones with antimicrobial resistance. And we need to put a lot of efforts to try to stop the spread and also, of course, treat the patients that have these infections. Thank you.